You're listening to an interview taken from the Tonic Talk Show and Podcast, heard exclusively on Zoomer Radio. To download or listen to the original episode or other episodes of The Tonic, please visit thetonic.ca.
Dr. Ludovic Brunel is a naturopathic physician trained at the Canadian College of Naturopathic Medicine in Toronto. Prior to his training as a doctor, he studied human nutrition at McGill University in Montreal. Dr. Brunel has spent the last 17 years helping patients optimize their health through better lifestyle and dietary supplementation. His passion remains educating the public, his patients, and colleagues. Welcome back to the show, Doctor. How are you?
I'm great. Thank you for having me. It's a pleasure to be here.
So, people who listen to the show know that I exercise regularly. I try and do stuff that isn't too much high impact, but then, there's stuff that's there, and it can wear and tear on the joints. So I'm glad you're here today because we're going to talk about the cycle of joint pain. Does that make sense?
For sure. It's a very common problem, and it's a condition that I see all the time in practice. Arthritis and joint pain is one of the most common conditions that affect Canadians, especially as they get older.
So why is it that we feel pain?
Pain is a defense mechanism. Basically, we feel pain because we're injured, and the pain lets us know that we need to rest. Pain is one of the 5 symptoms of inflammation, together with redness, increased heat, swelling, and loss of function. But once the injury heals, the pain should resolve. And so pain should be temporary and just help us protect an area that's been injured while it heals and recovers. The problem is that pain can become chronic, and that's what happens in arthritis. Mm-hmm. And it can be serious. Currently, 1 in 5 Canadians live every day with arthritis, and there's no real cure. However, there's lots of ways of alleviating symptoms, decreasing pain, restoring mobility, and really improving quality of life.
1 in 5. I had no idea that it was so prevalent. That's kind of surprising.
Like I was saying earlier, it's one of the most common problems that affects Canadians. And so, pain medication, things like over-the-counter NSAIDs are frequently used by those patients. And it can be really debilitating. It decreases our ability to exercise. And, of course, exercise is one of the most important things we can do to protect our health long-term. So, for a lot of people, it's a very serious health problem.
So what are the causes of arthritis and joint pain? Why do we get stiff and less mobile as we get older?
That's an excellent question. Traditionally, we thought that osteoarthritis, so the classic arthritis that we see when people age, was related to wear and tear. Basically, if you use your joints more, if you did more high-impact exercise, you would be more likely to end up with arthritis. Mm-hmm. We now know that that's not correct. Really, what's happening is that the body fails at repairing a damaged joint. And so through our daily life, we cause minor injuries in bones and muscle, but also in joints. And our body should be able to repair that and strengthen the area and prevent chronic pain and chronic joint degeneration, such as arthritis. The problem, though, is that for some patients or some people that doesn't happen, and then the joint starts to deteriorate. We lose joint space, the cartilage gets eroded, and then we end up with bone on bone, and that causes irritation, inflammation, pain, and the person is basically suffering and unable to exercise the way they want to. We also know that one of the key things in terms of protecting your joints is the muscles around those joints. So It's the muscles that absorb the force and help protect our joints from deteriorating and ending up with arthritis. Initially, we thought it was wear and tear simply because in a lot of athletes, we see that they have a higher risk of osteoarthritis. The reason for that, though, is injuries. And so if we look, for example, at soccer players, they're more likely to injure their knees, their ankles, their feet. And so once there is an injury, then we see that there's a much higher rate of arthritis in the future. There's other risk factors. Not enough exercise or lack of activity, of course, is not good. Mm-hmm. It reduces muscle strength, and then we end up having more force transmitted to our bones and joints. The aging process, of course, is another thing that can cause some deterioration of our joints. As we get older, we tend to lose some muscle strength, muscle mass. It becomes also harder to produce energy inside of our cells, and that energy is needed for repair mechanisms. Less protein in the diet is also a problem for muscle mass. It can lead to what's called sarcopenia, which is loss of muscle, which of course is more likely to lead to problems.
Mm-hmm.
In other cases, it's the immune system. And there we're talking about different types of arthritis. It's not
Right.
the osteoarthritis that I was just mentioning.
That's like psoriatic arthritis, right?
Psoriatic is definitely one of those. The other one that's well known is rheumatoid arthritis.
Yeah.
And there the immune system is targeting things that it shouldn't. So it's a classic autoimmune reaction. And in those cases, typically we want to do things that will balance the immune system, and probiotics there probably have the most research in terms of helping restore some balance to an immune system that's misfiring.
So if somebody came to you into your practice and it became obvious that they had osteoarthritis, how would you begin to treat that? How would you address it?
So there's a few things that we want to look at. One of the first things is always looking at nutrition. We want to make sure that the diet the person is following is not going to promote more inflammation and more arthritis. So often I'll recommend a Mediterranean-type diet. Basically, we're trying to focus on plant-based foods and things that come from the ocean, so things like fish or seafood that are higher in omega-3s and reduce inflammation. We want to reduce processed foods, especially things that are high in sugar, and limit the amount of red meat. Another alternative is Canada's Food Guide. The latest version of the Canadian Food Guide is a lot better than previous versions, and it's somewhat similar to what's recommended with the Mediterranean diet. So they're recommending to eat plenty of fruits and vegetables, foods that are high in protein, and eat whole grains. And so we want to try to focus on healthy nutrition to help repair mechanisms, but also decrease inflammation.
Mm-hmm.
There's other areas of lifestyle that are really important. Regular activity is one of those. Often people will think, oh, okay, I'm injured, I need to rest, and that's true at first. But exercise helps to reduce inflammation. It's one of the best ways of reducing inflammation in our body. So we want to try to get the person moving again as soon as possible. We'll have to adjust the exercise often. So if the foot is injured, then, for example, we may want to recommend more swimming or more motion with the upper body. Physical therapy is the other key component. And so there, physiotherapy, seeing a chiropractor, getting a massage, all of those types of therapies are usually very helpful. And of course, there's supplements. And in terms of supplements, usually I use a 3-prong approach. So we want to decrease inflammation.
Mm-hmm.
And some of the things I'll help there, fish oil, plant extracts, and other nutraceuticals can be used to reduce inflammation. We want to try to clean up the area and just get ready for repair mechanisms to take over. And that's something that I'll support with what's called proteolytic enzymes. And those enzymes help to clean up debris and dead tissue in areas where there's been an injury. And then lastly, we want to try to nourish ligaments and cartilage, and typically that type of repair mechanism I support with collagen and other nutrients like chondroitin, glucosamine, MSM, where we're trying to lubricate and just improve the health of the collagen in those articulations or joints.
Okay, so it's a 3-stage process, right? Where you start with getting rid of the inflammation, and then you sort of do the cleanup and then the building, right?
Exactly.
So if I came to you with an issue like an arthritic knee, like what are the timelines for something like that?
So it depends if you've suffered an acute injury first, but typically, the more acute stage where someone's been injured, that's going to last a few days up to a week.
Mm-hmm.
If there's a chronic problem such as arthritis, typically that's an ongoing process in terms of controlling inflammation.
Right.
Typically, we're looking at about a month before we can start seeing some improvements. And for some supplements like glucosamine, chondroitin, more the collagen-type supplements, typically we want to look at least 3 months down the road in terms of improving those structures.
Okay. So let's focus on those 3 steps. Let's start with dealing with the inflammation. So specifically, what sort of things are you doing to help with that?
Yeah, excellent question. So the fish oils or the omega-3s are usually one of the key components. Basically what happens there is that inflammation is produced inside of our cells, and the cell uses fat inside of the cellular membrane just picks a phospholipid in that membrane, and it starts to break it down into different components. Now, with the fish oil, we replace some of those fats or phospholipids in the cellular membrane. And so instead of pulling an arachidonic acid, which is a pro-inflammatory molecule inside the membrane, the body, if we use fish oils, is more likely to pick a fish oil molecule or an omega-3 molecule. And that leads to the production of molecules that reduce inflammation. So fish oils are key. It's one of these essential fats that really helps to decrease inflammation in the body. Now, there's also plant extracts where we have excellent research showing that they can minimize inflammation and reduce pain. Two of my favorites there are curcumin and boswellia. Mm-hmm. And the reason for that is that in our body, we typically produce inflammation through two different inflammatory cascades. One is called COX, which some people may be familiar with. The COX inhibitors, such as Celebrex in the past, were associated with some side effects. So some people have heard of those. Mm-hmm. The other one is LOX. And curcumin and boswellia are the only herbs that block both inflammatory cascades. And so they're typically more effective at lowering inflammation than some of the other natural or synthetic prescription anti-inflammatories. Curcumin in Canada also has a health claim, so it's approved by Health Canada, and the claim is that it's used in herbal medicine to help relieve joint inflammation. And so good research with curcumin and boswellia showing that there can be significant improvements in pain, but also inflammation.
And specifically for the cleanup aspect, what would you recommend?
So there, the proteolytic enzymes are usually very helpful. One of the most commonly used ones is called serrapeptase or serratiopeptidase, same thing. Mm-hmm. It's an anti-inflammatory, so the enzyme breaks up molecules that help produce inflammation. It also reduces pain. It helps to decrease swelling. And like I was saying earlier, it helps remove dead tissue. And so after an injury, those types of enzymes are really useful. Other enzymes in that category include trypsin and bromelain, and similarly reduce pain, inflammation, and also help to heal. And then in terms of the last aspect of the third component to help heal collagen and ligaments, cartilage, typically there what I would use are things like neem, which stands for natural eggshell membrane, which contains type 1 and type 5 collagen. So really important as a structural component in tissues such as skin, but also connective tissue, things like cartilage, ligaments, tendons, and even bone matrix. Other molecules or supplements in that category include glucosamine, chondroitin, and MSM. And there's great research showing that, in patients with osteoarthritic knees, for example, by using a combination of those supplements, we can significantly decrease pain and improve mobility and quality of life.
Okay, so a lot of these things that you mentioned sound to me like nutraceuticals that can be purchased. And what sort of recommendations do you have with respect to that?
Yeah, so all of those are available in your local health food store. You can look at having a consultation with your naturopathic doctor as well. Mm-hmm. But these are all available typically over the counter in health food stores.
And is there a brand in particular you would recommend?
I have several patients that are currently using the joint pain relief by Roots Herbal, and the product can combine some of those key ingredients that we talked about. So there is the neem in there, there's the curcumin, there's boswellia, there's also devil's claw, all known to reduce inflammation and help in terms of patients suffering from arthritic pain. I often recommend Roots Herbal simply because they have the highest quality standards. Their products are all standardized, and everything they do is tested in an advanced lab that's certified, and so we can be sure that the potency, the effectiveness is going to be there for their products.
Fantastic. Thank you so much for coming on the show today. Will you come back again soon?
Absolutely. I'd love to be back on the show. Thank you again for having me today.